I've got a good one for you today, guys. Coming up in today's video, we have some very, very full ear canals. It is a beast of a removal. Make sure you watch the ruler shot at the end. It is well worth it. My name is Rai Hook. I'm one of the audiologists here that works at Audiology Associates.
And my name is Taylor Green, and I also work here at Audiology Associates.
I don't know why it came out that way. It wasn't supposed to come out that way. So basically, I'll give you some backstory. This lovely, lovely guy came through. I did hint at this video at the beginning of the week. I did tell you it was coming. But basically, this lovely gent never had wax removal done before. All right, came in, was saying, you know, my one ear is really blocked. My other ear is absolutely fine. I don't have any problems with my other ear. This was the other ear. No. So as you can see, it is absolutely chock-a-block. And what we've got here is a very dry type of wax, very kind of hard keratin interspersed with the wax as well, which is why I'm using the Rai curette here. But you can see how much pressure I'm having to put on the Rai curette just to try and break some of this down. It is dry as a bone, tough as old boots, as we like to say. Right. So this is actually the Rai Hook now. So I'm trying to hook through this. I really thought we were going to get a good pull there, but we got a chunk.
It's that awkward in between consistency, isn't it? It's like solid, but it's not.
Yeah, it's almost like this bit's bolted onto one another with just very kind of loosely connected together. But you can see it almost goes crumbly as soon as you start putting a bit of pressure on it. And some of that is due to the skin that's around it. Some is to do with the wax that's going on in there as well. So it just does give you this really, really crumbly consistency. And you can see I'm trying to get some purchase on this, but it's just pulling straight through and it's just opening that plug up like a flower. But yeah, look at that. It is a very, very dry plug.
It's not a bad thing sometimes though when you can clear the centerpiece and it leaves all these outer parts, because you can, like you said, what you're doing now, you can kind of roll it into the center then and get a better grip with the suction.
Almost make a little wax marble out of it in the middle. You can kind of grip and pull. I mean, the keen eye amongst you would see as I was lifting that then, you could see the attachment underneath to the skin there. But this is just clearing as much of these little bits out as I possibly can. You know, they're not small pieces that are coming out so far. There's some sizable chunks in there. That's a nice pull. That's a nice
twisting then.
It did, didn't it? I thought, oh, I'll drop back a bit further now. You know, just get to the back end of this plug as we pull it. That's a chunky old piece there. And it wasn't the back end of the plug. There was a whole other section of dry skin back here. Now, I think this is a little bit of the start of keratosis obturans back here, because it's going to be one of two things. Either that big old wax plug in front of it was stopping some of this skin sort of migrating if it was coming away and sloughing away. Or it's the start of keratosis obturans. More prominent in the other side. Now, don't forget, this is the side the patient wasn't really having too much difficulty with. And as soon as I broke that one little bit that was adhering at the top and pulled that down, the gent was like, whoa, that is just so much louder suddenly. I can hear again. I was like, yeah, I'm not surprised. Look at this. But he was experiencing a little bit of pain on the other side, and that becomes the reason for that becomes apparent when he watched the second ear canal being cleared. But this one, you can see these softer, sluffier bits of skin coming away here. There we go. That's a nice raise. It might just, I can't remember whether I grabbed that with a forceps or whether it comes out with a, no, there you go, it comes out with a suction. But very, very dry pieces in here. Let's get these last bits off. Look at the colour of the canal. It almost looks like you're looking at it through Hessian. It's got this kind of very pale colour to it, and that's where that sort of dead skin layer is being attached all the way along. You can see the mottled eardrum there as well, where that's been attached.
There's probably someone thinking it in you know, who's watching this video saying, well, how did that patient not know that was in there? I mean, we do see it actually a lot. We do see it quite a lot, don't we, where someone's come in, they're like, oh, I've just been using oil in this side because this is the only one I'm having a problem with. And then you see this in both sides. It could be, there's a couple of different reasons usually. It could be the consistency of the wax and the skin in there. If it's quite hard, generally that will allow vibration to travel through harder wax a little bit easier, so that could be one of the reasons why they're hearing better. But it's the depth of it as well. Like, even though there was a lot in there, you could see as Reese pulled it forward, it looked like there was almost a little tiny gap between where the skin and the eardrum was, because you could see at one point you kind of popped your sort of endoscope over, And that, you know, oh, God, look at that.
Beastie
That could have
ones
been the
as
other
well.
reason, yeah.
Yeah, as long as you've got a little gap there,
Yeah.
that's something we'll be able to get through. No problem at all. You can see these big old chunks starting to come away now. Now, if you look to the right, see just to the right hand side of the suction tube, there's a little bump on the canal wall there. So I was thinking, it made it a little bit more awkward because you're trying to pull this big thick plug down, and that almost acts like a stop.
Yeah.
You know, so you're trying to get a square peg to a round hole then, so it's just really kind of hanging on to it. And if you see to this right side, I didn't notice this until watching the video now, but see how that thick skin there doesn't seem to be going anywhere on the right hand side? That becomes more apparent later on, all right? So just bear that in mind now. Now I've seen it, it kind of hints as to what's coming a bit later on.
Okay.
Guys, don't forget, if you're enjoying the videos, you can always like, heart, share, follow, and subscribe for us. That'd be fantastic. Or you could, if you really love them, become members of the channel, get to see more videos every single week, 2 more every single day. There we go. And does your comment come up in comment corner at the end? Make sure you stay tuned for that one. And if you have a question, put it in the comment section. They might appear on the comment corner later on.
Breathe.
There we go. Done. Yeah. No mouth to mouth, all right.
Oh, no.
So you can see we're just pulling this piece now. It is skin, mostly skin actually, and wax. And I'm trying to get a grip on this with a forceps. And you can see I'm really kind of struggling with this at the minute. Every time I get a grip, it pulls almost like a surface layer of the skin off, but not the actual bulk of the skin I'm trying to pull away.
Oh, they're tricky, and they're always difficult.
The easiest of things to do.
Especially when it narrows like that, and you've got this massive, all this debris in there.
Yeah.
You almost have to break it up then.
You've
got to.
You've got to. And you know, I'm trying to pull that side and see how it's just not budging from behind that lump, right? I keep pointing this out to you, but it's not budging from behind that lump. Now, bear in mind, this gent was having a bit of pain in here. He actually thought he had an ear infection, so his first protocol, he went to a local pharmacist, which is quite common here in the UK. Pharmacists are really, really good with things like ear infections and sort of minor ailments and stuff like that. So really, really good. Look how thick that skin is, guys. Wow. Really, really good for those kind of things. And they said, look, we can't see any obvious sign of infection. You have wax, you need to book in, and they signpost them to us. But what we've got is this very thick skin underlayer. So this is a little bit of canal remodeling, which is where some of this gent's pain was coming from. I'm gripping this hard piece of skin to the right hand side. It's pulled. There we go. That was basically connected to the canal wall, and you can see now that thicker underlayer.
Yeah.
But look at this next piece.
Oh, you almost had a ribbon then coming there.
It was almost there, wasn't it? Look how thick that keratin was there. I thought I'll pull it now. I'll aim a bit further back, see if I can bunch more of it into the forceps. But look just how much skin was there. But watch this. Look at that for a piece of skin.
Oh, no wonder he's getting discomfort and pain in that one.
Beastie there, isn't it? But you know, that was putting so much pressure on the canal wall. And now it's a case of tidying up. So I'll just tidy up these little couple of pieces here on the left-hand side. Let's just peel these away. Let's just get rid of them. So the more dead skin I can remove, the better chances your canals are returning to normal. Now, I have told this gent I want to see him every 12 months anyway, moving forwards. And then you can see that white layer at the bottom, but look at, you just caught a glimpse on the right-hand side. See this on the right now. So this is tucked behind that bump. Now remember I said earlier, watch that piece of dead skin, it wasn't budging from this side. The reason it wasn't budging is because it was attached to this. Now I can't see that, and I think if you would have missed it, if I'd angled the endoscope down into that one corner, but look how tough that skin is. Now I'm really trying to pull this out of there with a fine end, and it is just hanging on. I mean, in fairness, I've only just got enough protruding to get a grip with a fine end. I'm thinking, well, how big is this piece? Because it doesn't look huge there.
No.
See these layers, look,
layers.
The old dead skin.
Yeah, I can see you trying to reposition it now slightly.
Try to pull more across to the left to get that view behind, just to see where this ends up. And I'm really struggling here. This just does not want to come away. But patient, I did say to him afterwards, like, how are you doing? Does that feel better? He was going, the pain's gone. The pain just went. He's about halfway through the removal, the pain disappeared. And that was just so much pressure on those canal walls, bless him. It just doesn't want to budge, and that is holding in there tight. So I'm thinking, well, I can't use the standard size ulnar tube because there's not enough of it protruding past that bump to get a grip on. I'm still using this a minute. So I do switch to another tool in a second. The other tool is a little bit more effective than this one. Trying to get this out. I'm not giving up on it just yet. And I really want it gone because if this stays there, it's going to harden. And if it hardens as keratin, anything trying to migrate past that is going to hit that, and it's just going to get stuck. It's going to adhere to it, and it's going to look.
Yeah, it's coming.
It's really starting to peel away now.
Yeah.
It's a lot.
Push your bump in.
I know. Would you mind? I thought, forceps. I got to be honest. I went in with a forceps, and in the back of my head was going, "That's never going to work, Reese." Just because the skin was angled backwards, so you're trying to get the forceps button. I can't do it for the camera's reversed. But basically, I was trying to get a forceps grip on something like that. It didn't work. So I switched up now to the Rai Hook. And got a grip with the Rai Hook because it's a good tool to get. Like, I think if this was further in and it was on the canal wall, I wouldn't use a Rai Hook. But I think for this outer section, a bit more flexibility, not quite as sensitive, but it's doing a cracking job there. Fair play.
Wow. That's a lot of skin in that.
That was a heck of a lot. And you can see now why when I was trying to pull that piece of skin off the right hand side, it just wouldn't budge. It's because it was attached to this layer, and you can see how hard I'm having to try and pull this layer to get this out. But it's like one of those never-ending handkerchief things. You're pulling, and it's just more and more coming with it.
Yeah, it definitely needs to be gone as well. Those bits, they're, it's only going to build up again over time, and that's just going to add to the difficulty.
There we go.
Look at that.
It was a heck of a chunk down, still tucked in there, didn't it?
It looked tiny.
It did. It did look really, really small. I think I just try and tidy up this little bit here. Patient sat through a lot already, bless him. So I'm not too bothered. But if we can get some of this, if it comes away easy, which it didn't. I think there was this one little bit at the top here. So I just wanted to see if I could just grab that. And there you go. There it is. It's gone. So patient feeling much better. Oh, there was one more. Sorry, there's one more bit at the top. There's all these sneaky bits I kept finding. Every time it came out, I just catch a glimpse of another piece that needed to be removed. And there we go. Ear canal looking a lot clearer. Told you to stay for the rule of shot, didn't I, guys?
10 centimeters.
4 1/4 inches. Look at that.
Wow.
Oosh. Stephen the Waxing Lyricist, who's also a member of the channel. Thank you very much, Stephen. Also a contributor during Waxwork, guys, if you recognise any of the lyrics and that come up and the poetry that comes up over Waxwork, this is the man behind it, Stephen the Waxing Lyricist. He's actually been to clinic, so didn't he?
Yeah, he did, yeah. Met the lovely Stephen. He's a fab bloke, to be fair. Really nice guy. So this is quite an apt one for what we just did. So what's the difference in shape between the Rai Hook and the St. Bart's hook, and how do you decide which one to use? Rai Hook and I would say the St. Bart's hook is a little bit thicker and a little bit longer. I would say on the hook. The hook is.
I say it's good for broader, bigger chunks of wax. We've got good gaps there. You can. It's a good, almost like the difference between a shovel and a spade, right? So if you want to move a lot of object, it's big enough to get the St. Bart's hook behind it. Great for moving, pulling objects out. What's nice about the Rai Hook is it comes down to not a point as such, but it's
slightly rounded kind of.
It's a narrower end, so much better for kind of just getting into these smaller gaps. Really getting a bit of purchase on a stubborn plug. So I'd say if I've got a big old gap and it's a big plug, St. Bart's Hook works. Great. If it's a smaller gap, smaller bits, I find the Rai Hook works a lot better. That's the way I would kind of define it, I suppose. Yeah, it depends on where it is in the canal. If it's deeper, maybe I go Bart's because it's flat at the end. Maybe, I don't know. Born in 1900s. That was easy to say.
Yeah, nice one, What's the strangest thing you have fished out of an ear? Something a kid has pushed in, maybe. Well, I can't see any pediatric patients, so nothing that a kid has pushed in mine. But the strangest one for me was that really difficult when we had Christmas time last year was the hearing aid battery.
Oh yeah, that was a beastie to get out. That's on the channel as well, guys.
It is on the channel.
So you have to go back through. I think it's called "What Is That?"
Yeah.
Question mark.
Yeah, very. It was a very difficult. We both had to go, didn't we? It was very difficult. Patient got really confused, bless her, and it got really infected. The battery had started to corrode, and you can imagine the discharge and the swelling that was there. It was We didn't know what it was. We just thought it was like a bulge of something. Yeah. I could tell it was solid, but yeah, when it eventually came out, you could see like the battery was starting to rust, and it was like,
because the skin had almost wrapped around it.
Yeah. So yeah, hearing aid battery for me.
I've had a couple of odd ones. Yes, when I work with pediatrics, you do see some odd stuff. I've seen shards of glass in the kid's ear. I remember doing that one when I was first starting out. What else was it? Weirdly, plasticine in an adult's ear.
Oh, I think I remember that one.
Yeah, I was a bit. And he had no recollection of how that got in there, which I found really, really odd. He thought he'd fallen asleep on the sofa, and one of his kids had pushed in his ear when he'd fallen asleep. So that was an odd one. The arm of a pair of glasses. Seen that?
Oh, adding to mine as well. You just reminded me there. I had that lady that had the dental.
Oh, the dental toothbrush. The dental brushes.
Yeah, and both ears.
That was another one. These are all on the channel, by the way, guys. Apart from the shard of glass, because that was before I did the channel. But yeah, they're all on there. So we do see some weird and wonderful things on there. It's surprising what you find in ear canals, guys. If you want a slightly different, the most common, cotton bud ends.
Oh. All the time.
All the time. Constantly. I don't know what they do to them, honestly. But it's, combat ends. Well, guys, thank you very much for watching the video today. I hope you enjoyed it as much as we did voicing it over. If you want your question to appear here, don't forget, put it in the comment section. It's the only way it's going to appear here. And do think of a better name in the comment corner, guys. It would be much better for me if you don't mind. But until next time, guys, as always, take care of yourselves.
Take care of your ears.
And take care of one another. Myself and lovely Miss Taylor Green. We'll see you again soon. Bye, everybody.
Bye-bye.